Welcome to our exploration of quantitative research methods in diagnostic radiology. In this video, we'll uncover how numbers, measurements, and statistical techniques are transforming the field of medical imaging. Quantitative research provides objective, reproducible data that helps radiologists make more accurate diagnoses and improve patient outcomes. By the end of this journey, you'll understand the core principles behind quantitative research and how they apply to radiology, setting the stage for deeper dives into specific methods and applications in the scenes ahead. Quantitative research is all about collecting and analyzing numerical data to identify patterns, relationships, and trends. In diagnostic radiology, this means using measurable variables, like tissue density, lesion size, or signal intensity, to draw conclusions about health and disease. Unlike qualitative research, which focuses on subjective experiences, quantitative methods rely on hard data and statistical analysis. This approach ensures that findings are objective, reproducible, and can be generalized to larger populations, making it a cornerstone of evidence-based medicine. In diagnostic radiology, quantitative research methods are used to validate imaging techniques, develop new diagnostic criteria, and assess the effectiveness of treatments. By applying statistical tools to imaging data, researchers can compare different modalities, evaluate diagnostic accuracy, and monitor disease progression. This evidence-based approach not only improves clinical decision-making but also drives innovation in imaging technology, ensuring that patients receive the most accurate and effective care possible. Quantitative research in radiology encompasses several study designs, each with its own strengths and limitations. Common types include cross-sectional studies which analyze data at a single point in time, cohort studies which follow groups over time, and randomized controlled trials which compare interventions in controlled settings. By choosing the right study design, researchers can answer specific questions about diagnostic accuracy, disease prevalence, or treatment outcomes, ensuring that their findings are robust and reliable. Accurate data collection is the foundation of quantitative research in radiology. This process involves gathering numerical measurements from imaging studies, such as CT, MRI, or ultrasound scans. Researchers must ensure that data is collected consistently and systematically, using standardized protocols to minimize variability. High-quality data collection not only improves the reliability of research findings, but also enables meaningful comparisons across studies and institutions. Quantitative radiology, measurement techniques are critical for extracting meaningful data from images. These techniques may involve measuring the size of a tumor, the density of bone, or the intensity of a signal in a specific region. Advanced software tools and automated algorithms are often used to ensure precision and reproducibility. By standardizing measurement techniques, researchers can reduce bias and improve the accuracy of their analyses. Once data is collected, statistical analysis is used to interpret the results. Basic statistical methods include calculating means, medians, and standard deviations to summarize data. More advanced techniques, such as regression analysis or hypothesis testing, help researchers identify significant differences or relationships between variables. Understanding these statistical tools is essential for drawing valid conclusions from quantitative research in radiology. Imaging biomarkers are quantifiable features extracted from medical images that provide information about normal or pathological processes. Examples include tumor volume, tissue perfusion, or bone mineral density. These biomarkers are essential for diagnosing diseases, monitoring treatment response, and predicting outcomes. Quantitative research methods help validate the reliability and clinical relevance of these biomarkers, making them powerful tools in modern radiology. Quantitative imaging techniques such as diffusion-weighted MRI or dual-energy CT allow for precise measurement of tissue characteristics. These advanced methods provide detailed information about tissue structure, function, and composition, enabling earlier and more accurate diagnosis. By integrating quantitative techniques into routine practice, radiologists can enhance diagnostic confidence and improve patient care. Automation is playing an increasingly important role in quantitative radiology. Automated image analysis tools can quickly and accurately measure anatomical structures, detect abnormalities, and generate quantitative reports. These tools not only save time but also reduce human error, leading to more consistent and reliable results. As technology advances, automation will continue to drive progress in quantitative research. Rise of big data has revolutionized quantitative research in radiology. Large-scale databases of medical images and patient information enable researchers to identify patterns and trends that were previously impossible to detect. By leveraging big data, radiologists can develop predictive models, improve diagnostic accuracy, and personalize patient care. However, managing and analyzing such vast amounts of data also presents new challenges. Machine learning is transforming quantitative research in diagnostic radiology. By training algorithms on large datasets, researchers can develop models that automatically detect diseases, classify images, and predict outcomes. These tools are especially valuable for analyzing complex imaging data where traditional methods may fall short. As machine learning continues to evolve, its impact on radiology research will only grow. Ensuring quality and consistency is essential in quantitative radiology research. Quality assurance measures include standardized imaging protocols, regular calibration of equipment, and rigorous data validation. By maintaining high standards, researchers can minimize errors and ensure that their findings are accurate and reproducible. Quality assurance is a continuous process that underpins the credibility of quantitative research. Ethical considerations are paramount in quantitative radiology research. Researchers must ensure patient privacy, obtain informed consent, and adhere to ethical guidelines when collecting and analyzing data. Protecting patient rights and maintaining confidentiality are not only legal requirements but also essential for maintaining public trust in medical research. Determining the appropriate sample size is a critical step in quantitative research. A study with too few participants may lack the statistical power to detect meaningful differences, while an excessively large sample can waste resources. Researchers use statistical formulas to calculate the optimal sample size, ensuring that their studies are both efficient and effective. Randomization and blinding are key strategies for reducing bias in quantitative research. Randomization ensures that participants are assigned to groups by chance, while blinding prevents researchers and participants from knowing which group they belong to. These techniques help ensure that study results are objective and not influenced by preconceived notions or expectations. Effective data management is essential for the success of quantitative research in radiology. This involves organizing, storing, and securing data throughout the research process. Robust data management systems help prevent data loss, ensure data integrity, and facilitate efficient analysis. With the increasing volume of imaging data, proper management is more important than ever. For analysis, data must be cleaned and preprocessed to remove errors, inconsistencies, and missing values. This step ensures that the dataset is accurate and ready for statistical analysis. Data cleaning may involve correcting entry mistakes, standardizing formats, and handling outliers. Proper preprocessing is crucial for obtaining reliable and valid research results. Descriptive statistics provide a summary of the main features of a dataset. Common measures include mean, median, mode, range, and standard deviation. In radiology research, these statistics help describe the distribution of imaging measurements, identify trends, and highlight differences between groups. Descriptive statistics are the first step in understanding and interpreting quantitative data. Inferential statistics allow researchers to make predictions or draw conclusions about a population based on a sample. Techniques such as hypothesis testing, confidence intervals, and regression analysis are commonly used. In radiology, inferential statistics help determine whether observed differences in imaging data are statistically significant or due to chance. Regression analysis is a powerful statistical tool used to examine the relationship between variables. In radiology, it can help identify factors that influence imaging outcomes, such as patient age, disease severity, or treatment type. By modeling these relationships, researchers can make predictions and better understand the underlying mechanisms of disease. Hypothesis testing is a core component of quantitative research. Researchers start with a hypothesis, a statement about the expected relationship between variables, and use statistical tests to determine whether the data supports it. In radiology, hypothesis testing helps validate new imaging techniques, compare diagnostic tools, and assess treatment effects. Sensitivity and specificity are key measures of diagnostic accuracy in radiology. Sensitivity refers to a test's ability to correctly identify patients with a disease, while specificity measures its ability to correctly identify those without the disease. High sensitivity and specificity are essential for reliable diagnostic tests, and quantitative research helps evaluate and improve these metrics. ROC curves are graphical tools used to assess the diagnostic performance of imaging tests. By plotting sensitivity against one specificity, researchers can visualize the trade-off between true positive and false positive rates. The area under the ROC curve, AUC, provides a single measure of overall test accuracy, making it a valuable tool in quantitative radiology research. Inter-observer agreement measures how consistently different radiologists interpret the same images. High agreement indicates that a diagnostic method is reliable and reproducible. Quantitative research uses statistical measures, such as kappa statistics, to assess inter-observer agreement and identify areas where additional training or standardization may be needed. Longitudinal studies follow patients over time to observe changes in imaging findings and clinical outcomes. These studies are valuable for monitoring disease progression, evaluating treatment effects, and identifying long-term trends. Quantitative methods ensure that changes are measured accurately and consistently, providing robust evidence for clinical decision-making. Meta-analysis combines data from multiple studies to provide a more comprehensive assessment of diagnostic tests or treatments. By pooling results, researchers can increase statistical power and identify patterns that may not be apparent in individual studies. Meta-analysis is a key tool for evidence-based practice in radiology. While quantitative research offers many advantages, it also has limitations. Not all clinical questions can be answered with numbers alone, and some aspects of patient care require qualitative insights. Additionally, quantitative studies may be affected by measurement errors, selection bias, or confounding variables. Recognizing these limitations is essential for interpreting research findings accurately. Many radiology researchers combine quantitative and qualitative methods to gain a more complete understanding of complex issues. While quantitative methods provide objective data, qualitative approaches capture patient experiences and contextual factors. This mixed methods approach can lead to more comprehensive and meaningful research outcomes. Adhering to reporting standards is crucial for ensuring transparency and reproducibility in quantitative radiology research. Guidelines such as SDARD, Standards for Reporting Diagnostic Accuracy, and Consort Consolidated Standards of Reporting Trials, help researchers present their methods and results clearly. Following these standards enhances the credibility and impact of research findings. Peer review process is a critical step in publishing quantitative research. Independent experts evaluate the study's methodology, data analysis, and conclusions to ensure scientific rigor. Constructive feedback from peer reviewers helps improve the quality of research and ensures that only high-quality studies are published in reputable journals. One of the main goals of quantitative research in radiology is to translate findings into clinical practice. By providing robust evidence, research helps inform guidelines, improve diagnostic protocols, and enhance patient care. The journey from research to practice involves collaboration between researchers, clinicians, and policymakers. Quantitative research is an ongoing process that drives continuous improvement in diagnostic radiology. As new technologies and methods emerge, researchers must adapt their approaches and update their knowledge. Lifelong learning and a commitment to quality are essential for staying at the forefront of the field. Let's look at a practical example, measuring tumor size in MRI scans. Quantitative research methods ensure that measurements are accurate, reproducible, and clinically meaningful. By using standardized protocols and automated tools, radiologists can track tumor growth over time and assess treatment response, leading to better patient management. Another example is bone density analysis using quantitative CT or DEXA scans. These techniques provide precise measurements of bone mineral content, helping diagnose osteoporosis and monitor treatment effectiveness. Quantitative research validates these methods and ensures that results are reliable across different populations and imaging systems. Fusion imaging measures blood flow in tissues using quantitative techniques like dynamic contrast-enhanced (MRI). These methods are valuable for assessing tumor vascularity, detecting ischemia, and guiding treatment decisions. Quantitative research ensures that perfusion measurements are accurate and clinically relevant. Quantitative analysis of lung nodules using CT scans helps differentiate benign from malignant lesions. Automated measurement tools can assess nodule size, shape, and growth rate, providing valuable information for diagnosis and management. Quantitative research validates these tools and ensures their reliability in clinical practice. In cardiac imaging, quantitative methods are used to measure parameters like ejection fraction, myocardial thickness, and blood flow. These measurements are essential for diagnosing heart disease, monitoring progression, and evaluating treatment response. Quantitative research ensures that cardiac imaging techniques are accurate and clinically useful. Quantitative brain imaging techniques such as volumetric MRI allow for precise measurement of brain structures. These methods are used to study neurodegenerative diseases, monitor brain development, and assess the effects of injury or treatment. Quantitative research provides the evidence needed to validate and refine these techniques. Quantitative liver imaging techniques such as elastography and fat quantification provide valuable information about liver health. These methods help diagnose conditions like fibrosis and steatosis, monitor disease progression, and guide treatment decisions. Quantitative research ensures that liver imaging techniques are accurate and reliable. In musculoskeletal imaging, quantitative methods are used to assess joint space width, cartilage thickness, and bone quality. These measurements are important for diagnosing arthritis, monitoring injury recovery, and evaluating treatment outcomes. Quantitative research validates these techniques and ensures their clinical utility. Quantitative research methods are also applied in pediatric imaging to assess growth, development, and disease. Accurate measurements are essential for diagnosing congenital conditions, monitoring development, and evaluating treatment in children. Quantitative research ensures that pediatric imaging techniques are safe, effective, and tailored to young patients. Future of quantitative research in diagnostic radiology is bright. Advances in artificial intelligence, big data analytics, and imaging technology will continue to expand the possibilities for quantitative analysis. Researchers are exploring new biomarkers, developing more sophisticated algorithms, and integrating multimodal data to improve diagnosis and treatment. Despite the progress, challenges remain in quantitative radiology research. Issues such as data privacy, standardization, and integration of new technologies must be addressed. Collaboration between researchers, clinicians, and industry partners will be essential for overcoming these obstacles and realizing the full potential of quantitative methods. Summary: quantitative research methods are transforming diagnostic radiology by providing objective, reproducible, and clinically meaningful data. From validating new imaging techniques to improving patient care, quantitative research is at the heart of innovation in radiology. As technology continues to evolve, the role of quantitative methods will only grow, shaping the future of medical imaging for years to come.